Hello everyone. Today's topic of discussion will be thyroid gland. Thyroid is a small gland which is present just in front of your neck. So this is the place where your thyroid gland stays, and it produces only two hormones which are called T4 and T3. These are called the thyroid hormones. So it helps maintain multiple functions in your body: bowel movements, dryness of the skin, hair growth, metabolism, and then glucose levels. Everything are maintained by this. Not completely, but everything is maintained in a minor way. So once these are affected, there are lot many changes in your body happening. We need to check these things at a regular interval. First, we'll talk about hypothyroid. So, hypothyroid, most of the times, it is idiopathic, and few times it can be autoimmune. Autoimmune in the sense wherein body's immune cells trying to destroy the thyroid gland, because any viral infection which mimics the same structural similarity to the thyroid gland might affect the body. So in the process of destroying the infection, body even tries to destroy the thyroid gland because both are having a similar look. So this way the thyroid glands get destroyed. So once these get destroyed, as I said, the T4, T3 will become low. So then there is another hormone called thyroid stimulating hormone, which comes from the pituitary. This keeps rising as the thyroid hormones are not coming. So this is the reason for hypothyroid. So this is the reason when you look at a thyroid hypothyroid picture in a lab reading, the T4, T3 can be normal or low, and the TSH being on the higher side. Females usually tend to have a higher risk of getting hypothyroid because of the autoimmune etiology, because autoimmune diseases tend to be on the higher side in the females compared to men. Apart from this, rest everything is same. When you order for a blood test, you usually order for a thyroid profile, so which contains thyroid stimulating hormone, which is called TSH, and then T4 and T3. These are the most regularly used. Apart from these, there are PT3, PT4, TPO antibody, and then antithyroglobulin antibody, and then thyroid receptor antibody, multiple things. Any people getting the thyroid profile usually contains TSH, which is called thyroid stimulating hormone. Then there is T4, and then there is T3. So T4 and T3 are called thyroid hormones. When T3, T4 are on the higher side and TSH is on the lower side, it is called hyperthyroid. And when T4, T3 are on the lower side and then TSH is on the higher side, it is called hypothyroid. Usually it controls metabolism. So you might initially, early stages, you will not feel anything, but at a later stage, you start developing lethargy, fatigue at work, then you're not feeling interested in your regular day-to-day activities, then there can be a tendency in weight gain, then there can be constipation, hair fall. So all these things, if these things are troubling you, I think definitely you should suspect a hypothyroid and get your thyroid profile done, or go to a nearest doctor, and then they might advise you to get the test done, and then you can get it diagnosed. This is about the hypothyroid. Coming to the hyperthyroid, as I said, hyperthyroid is an increased hormone. So there will be increased metabolism. So there can be weight loss. There can be palpitations or increased heartbeat. You're feeling your heart beating faster. Then there can be shivering in your hands, sweating, and then there can be increased bowel movements. So all these things you should suspect hyperthyroid or reach out to an endocrinologist nearby. They can help you with the diagnosis and then run few labs, and then you can be, if there is a problem, I think you'll be knowing it. Physical impact in hypothyroid, usually there is a weight gain. In hyperthyroid, there can be weight loss. So coming to the mental disturbances, very high level of hypothyroidism can cause to depression. We'll divide this into two broad categories, hypo and hyper. So definitely hyperthyroid is treatable, curable, both. There are multiple options to treat it with drugs, radioactive iodine therapies, and then surgeries. And definitely the cure is there. Coming to hypothyroid, hypothyroid is what your gland is not functioning. It is unable to produce enough hormone. So we cannot increase the functioning of the gland. So once destroyed, the functioning of the gland is gone. So here we need to supplement the thyroid hormone depending on the severity, it could be for lifetime, but the drugs can be given for life. There is no side effects or complications if you're taking a thyroid hormone. The simple hormone which is produced in the body is being given from outside, and it's completely safe. And though we are taking it for life, we need not be worried. Hypothyroid, we will be supplementing the thyroid hormone medication. So once we start supplementing, we need to check regularly whether whatever we are giving, whatever the dose we are giving, whether it is sufficient for your body or not. So this will come to know by regularly checking your thyroid hormones. So by checking this, we'll know, and then we'll slowly titrate it to the required levels. And once the required levels reach, we continue with the same dose. We keep checking initially at a earlier time, like in 1 to 2 months, or sometimes once in 3 months. But once the control is really good, and then you're able to maintain with the same dose, then your follow-ups can be much longer. This is about the hypothyroid thing. So coming to the hyperthyroid, we have, as I said earlier, there are multiple medications to treat hyperthyroid. One is drugs, then the other is radioactive iodine therapy, and the third is the surgery. So here we have to decide based on a patient to patient basis, depending on the severity of the disease and all these things. So it is usually drugs. If we start treating, usually takes 1.5 to 2 years of management to control the disease and then stop the medications. Hypothyroid, there is one, because this is a lifelong disease, there are few things we have to follow when you're taking the tablet. So you have to take the tablet early morning, empty stomach, and after taking the tablet for 45 minutes, you should not eat or drink anything except for water. So this is one routine you have to follow when you're already a hypothyroid and taking thyroid medications. When you skip a tablet or you forgot a tablet, the next day morning you can take 2 tablets. As I told, this is all hypothyroid is or hyperthyroid tumor matrix, not autoimmune condition, is not in our hands really. So a lot of environmental factors come into play. I think viral infections, if we prevent the regular infections happening to us, I think that is one way we can prevent, because any infection coming which is mimicking a thyroid gland can trigger an autoimmune response and can destroy the gland. But there should be a genetic predisposition to this. So I don't think we have much to prevent at this point. I think in future we might be getting newer trials and newer studies and newer insights which might help us prevent the disease entirely.